At this year's American College of Chest Physicians meeting, and I just wanted to let you all know about some particular themes that I have felt just buzzed through this whole meeting. One is that the impact of personalized medicine on pulmonary disease is going to be huge. It's already impacting the field, whether we're talking about diagnosis or treatment. But one thing I heard that was really interesting is maybe it should also impact trial selection. So there was a presenter who talked about the FDA is starting to take notice that its criteria might need to change according to whatever the trial is, since the pathophysiology of disease is now being seen as specific to the patient. So you want to maybe keep your eye on that. That's interesting. I attended a really packed session on COPD, and what was so lively about it, and it was definitely a lively session, was the efficacy of the GOLD guidelines versus the Spanish ones. And at issue was the fact that the Spanish guidelines actually include phenotype in the criteria, whereas the GOLD do not. However, there was a takeaway there, and that is if you use guidelines, and this presenter said you should use the guidelines, whichever one you use them. Don't jump from one to the other. So you may want to check that out as well. That was very interesting. Another theme has been crisis and risk management. Medical reporters attend meetings all year long across the specialties, and there is definitely a zeitgeist that I'm picking up on that physicians are becoming aware of the need for disaster preparedness. Whether we're talking about something like Hurricane Sandy, where an entire region's worth of ICUs needed to be evacuated, or something like the Boston Marathon bombing, where there were a lot of ICUs that had to be on alert, or trauma centers that had to be on alert. And the chest physicians are no different. In 2014, you can expect a concept paper on ICU evacuation and also an education module that's going to go along with that. So keep your eyes open for that. Also, no surprise, accountability, reimbursements, and also futility in the ICU, which of course, treatment that costs a lot of money and doesn't end up with a result that can bear out the cost. These are very important topics, particularly as Obamacare is still finding its legs. Big theme and a lot of coverage about it. So you can expect that we will bring you lots of stories to do with those things as well. Also, there's a video that you may want to check out at chestphysician.org covering the impact of Obamacare specifically on pulmonologists and on the field. So I mentioned the website. The fact is, the college does have a new website, chestphysician.org, and we have some really fun, fun if you're a pulmonologist, right? Fun videos. But there's one that I wanted to bring a special attention to because it's just really unique. It's unusual. My colleague, Patrice Wendling, who's the Chicago bureau chief, she talked to a doctor about the rise in hookah use. And you may be wondering, well, what's a hookah? A hookah is a type of tobacco pipe that's really rather elaborate. You may remember it from Alice in Wonderland. Remember the caterpillar with his little contraption? Well, that was a hookah. And it's a way to use tobacco that you may not know about, but it's actually increasing while tobacco use in cigarettes is going down. So you may be treating people who have been using a hookah and you may not know it. So definitely check that out as well. Next year it's Austin. And check us out on the web. I'm Whitney McKnight, and this is from the American College of Chest Physicians in Chicago, 2013.